Hey, this is Dr. Linicky here to do the podcast for aerobic exercise. First, there are some key terms and concepts that you need to know related to aerobic exercise. So one is physical activity, and this is any bodily movement produced by the contraction of skeletal muscles that results in an increase over the resting energy expenditure. So physical activity is anything that you do that results in doing more than just sitting around. Where exercise is a planned and structured activity designed to improve or maintain physical fitness. That is an important, I say, distinction. If you are a trained athlete and you go for a walk, that is probably physical activity. It's not really improving or maintaining your physical fitness. It is an activity that is below your physical capabilities. So I say if Dr. Satgast or Dr. Fox go for a 10-minute walk, not really considered exercise. But if you're an individual who has a very low level of physical activity and you're trying to get into an exercise program, a walk may be exercise for you. So if you are improving or maintaining fitness by doing that activity, it can be considered exercise. Where physical fitness is the ability to perform any kind of physical work. More key terms. Maximum oxygen consumption. This is your body's capacity to use oxygen. It is often called VO2 max. Those who have a higher fitness level will have an improved VO2 max over those who are in a poor physical condition. Endurance is your ability to work for long periods of time and resist fatigue. Aerobic exercise training. So back to endurance. Remember there's muscular endurance and cardiovascular endurance. Now when we're talking about exercise and aerobic exercise training, we are specifically working on the cardiorespiratory aspect or the cardiovascular aspect of that endurance. The thing with aerobic exercise is that the energy utilization is by a different means than a general muscle movement. Okay, so you have to get into, we'll talk about energy expenditure here in a bit, but you have to get into the aerobic energy expenditure. Adaptation is the ability to adapt to the training stimulus over time. With cardiovascular or aerobic exercise, it is the cardiovascular system that adapts more so than the muscles. Myocardial oxygen consumption, that's the amount of oxygen consumed by the cardiac muscle. Deconditioning. This occurs in patients with prolonged bed rest. So you'll see these in somebody that's been in the ICU for several weeks, maybe someone who had a surgery and was unable to be up and weight bearing. It is very common in long-term chronic conditions. The effects of deconditioning include decreased muscle mass, strength, cardiovascular function, total blood volume, plasma volume, heart volume, orthostatic tolerance. So if someone's been deconditioned for a long period of time and they go from supine to sit, they're very likely to get orthostasis. Decreased exercise tolerance and decreased bone mineral density. And we talked about exercising in a resistive exercise form for those who have poor bone mineral density. So you need to consider that when you are exercising someone who's been deconditioned. All right, let's talk about the energy systems we use with physical activity. And we've reviewed some of these before already in our resistance exercise talk. But we have the ATP PC system, the anaerobic glycolytic system, and the aerobic system. So first, the ATP PC system. All right, for the ATP PC system, this is what's used during the initial bout of activity, especially with high-level activity. No oxygen is required, and the PC and ATP are stored in that muscle cell. The PC is the chemical fuel source that is used. So this is used for the initial bout of activity. Next we have the anaerobic glycolytic system. And so this is the glucose is the fuel source for this, and this is what is used from about 30 seconds to 90 seconds, maybe up to 2 minutes in trained athletes. This is also anaerobic, so no oxygen is required. When you use the glycolytic system, lactic acid is produced, and it does provide energy for moderate intensity activities of short duration. And then finally, the aerobic system, which is the system we're going to talk about the most during this chapter on aerobic activity. So for the aerobic system, oxygen is required in this energy system, and so this is why you get an increase in oxygen consumption, increase in heart rate, your lungs expand, and you need muscles that are that have a blood supply and can get, well, I guess all muscles have a blood supply, but muscles need that blood supply to be able to reproduce or replenish the fuel source. The ATP is resynthesized in the mitochondria, and the ability to metabolize oxygen and other substrates is related to the number and concentration of mitochondria in the cells. This predominates when the other energy systems have been used, so at least by the second minute of exercise. Alright, and we're going to talk about motor units again and muscle fibers. So we have the type 1, type 2A, and type 2B. So with aerobic endurance exercises, those slow twitch muscle fibers are recruited for endurance. Additionally, though, the type 2A fibers are also recruited for both anaerobic and aerobic activities. Initially, your body will use those fast twitch type 2B fibers if you're creating power, but for any kind of sustained activity, the 2A and the type 1 are utilized. So what does this all mean? What functional implications do we have to these muscle fiber types? So initially, and to this energy system, I should say, initially the bursts of intense activity that only last a few seconds are going to use the ATP PC system. These help develop strength, and this helps develop stronger tendons and ligaments. But if you are continuing activity and you have intense activity that lasts 1 to 2 minutes, this starts to enhance the anaerobic power, and the anaerobic glycolytic system prevails. If these large muscle activities continue in about 3 to 5 minutes, you are starting to develop aerobic power and endurance. So you have your ATP PC system working, your anaerobic system working, and your aerobic system working. But if you the ATP PC system and the anaerobic system will get replenishments, but not enough to sustain them. And so if you have submaximal but intense activity lasting more than 20 minutes, you are utilizing your aerobic system. All right, energy expenditure. When we're quantifying energy expenditure, the way most people have heard about it is through calories. How many calories did I burn? Well, the word calorie is actually kilocalories when we're talking about the scientific term of it, and it's the amount of energy it takes to change 1 gram of water 1 degree Celsius. And so kilocalorie is a measurement of heat and a measurement of energy. We also can quantify things in terms of METs. So a MET is defined as the oxygen consumed by the body per kilogram of body weight per minute. And so lower metabolic rates or lower METs are usually when the body is sitting and resting. When you're doing higher level activities, your metabolic rate is higher, or your METs are higher. I'm sorry, not metabolic rate, your METs are higher. So here's some activities at home and their MET rate. And so sweeping a carpet, about 3.3 METs. Gardening, playing with a dog with moderate intensity is 4 METs. Washing and waxing your car, 4.5. Playing with your kids vigorously is 5. That does not count sitting and playing video games with them. You have to be outside running. Moving furniture is 6 METs. This is good to understand for patients who, especially who have a cardiovascular disease or are recovering in cardiac rehab. Often the cardiac doctors will say, I want no activity higher than 3 METs or 4 METs, and they can progress in that manner. Here's another chart with just some examples between light, moderate, and vigorous MET activity. So sleeping is 0.9 METs, sitting and watching television is 1 MET. If you walk 1.7 miles per hour, that is about 2.3 METs, which could be considered a slow stroll. Pick up the pace slightly at 2.5 miles per hour, and that would be 2.9 METs. Moderate activity, such as bicycling, walking, light to moderate exercise, those are between the 3 and 6 METs. And then more vigorous activities, such as jogging, vigorous effort exercises, and jumping rope are greater than 6. Right, what is the cardiovascular response to exercise? Well, one, you have the exercise pressor response, and this is a response of the sympathetic nervous system. So what happens with this is you get vasoconstriction of muscles that are not being used. Your heart has increased contractility, so it is beating with greater contraction, which increases your heart rate, and it can have an increased systolic blood pressure. This does help to result in an increased cardiac output, and it helps get the blood and oxygen to the muscles that are using it for activity. Respiratory responses to aerobic exercise include getting additional oxygen to muscles through increased blood flow, increased oxygen extraction from the arterial blood, and an improved oxygen consumption. So when they are breathing, there is a better taking of oxygen from the air. All right, the determinants of an exercise program. So FIT VP, so frequency, intensity, time, type, volume, and progression. We'll talk about this we've talked about this with strengthening exercises, but it also comes into effect with aerobic exercise. So frequency can mean things such as daily, twice a day, twice a week. Performing aerobic training optimally is generally 3 to 4 times a week. A frequency of 2 times a week does not typically create significant cardiovascular changes, but in a deconditioned or an older individual, they still can benefit from twice a week. Right, intensity. In an aerobic program, intensity is often considered a percentage of the max heart rate. We're going to talk about how to determine max heart rate in the next few slides. Realize overload principle and specificity still come into play. So the exercise load, which is overload, must be above the training stimulus threshold, or the typical or the stimulus that elicits a training or conditioning response for adaptation to occur. With specificity, if you are working cardiovascularly, you will gain cardiovascular benefits. This may not play over to strength gains. For healthy and well-trained individuals, the optimal percentage of heart rate is around 70%. Realizing that individuals who are at risk may need a lower percentage, such as much as low as 40 to 60% of their maximum heart rate. Time and or duration, this is how long you will exercise. So if you're doing a 20 to 30 minute session at 75% of your maximum heart rate, that is optimal for cardiovascular conditioning. If the intensity is below your 70%, a higher time or duration may be needed, up to 45 minutes. If you're doing high intensity exercises, a 10 to 15 minute exercise period may be sufficient. And type, this is the mode of exercise. So for cardiovascular and endurance exercises, you need to use large muscle groups that are activated in a very rhythmic nature, such that it stresses the cardiovascular system. Right, volume is the quantity of exercises completed within a week, and this is a product of the frequency, the intensity, and the time. There are recommendations for METs. So to decrease cardiovascular disease in adults, they recommend 500 to 1,000 MET minutes per week. So if you're doing an activity that is 6 METs and you're doing it for 10 minutes, that would be considered 60 MET minutes. So if an individual can get at least 500 of those decrease the cardiovascular risk. And then progression. You want to progress time first, frequency second, and intensity third with aerobic exercise. And the reversibility principle holds true in aerobic exercise too. Reversibility occurs rapidly, and you can get measurable changes in as few as 2 weeks. And so the intensity for aerobic exercise, when you're talking about the percentage of maximum heart rate, conditioning usually occurs between 60 and 90% of the maximum heart rate. But for deconditioned individuals, conditioning may begin to occur at 40 to 50% of the maximum heart rate. All right, so how do we determine the maximum heart rate? There are several methods to do this. One is the multi-stage test. It's often done on a treadmill with cardiac monitoring. It is a great method to determine maximum heart rate in young, healthy individuals. It is also unrealistic. If we were going to determine how much aerobic activity we're going to have a patient do, and we have them in the clinic, having them do a multi-stage test with cardiac monitoring isn't practical. Heart rate from a predetermined submaximal test can be done. So such tests can be a step test or a 6-minute walk test. I think in lab during your exercise prescription class you'll be able to get to do some of these tests. Another one is 220 minus your age, which has not been shown to be very accurate. The Carvonin formula is one that has been shown to be a little bit more accurate. So in this, you would take your target heart rate, or you would calculate your target heart rate by taking your maximum heart rate, which is that 220 minus your age, and subtracting your resting heart rate. You will get a number. You're then going to multiply that by the intensity. So if you want to work at 70%, you would multiply that by 70% and then re-add your resting heart rate. That's a good formula to use. Right, the Borg RPE scale has been used to also determine heart rate. This is a rate of perceived exertion, and it does correlate to heart rate. It has been designed that if somebody says they are doing an activity that is fairly light and they give it an 11, their heart rate will be approximately 110 degrees. And there's been some good studies that show a correlation. If they say they are working very hard and they give the number 17, their heart rate is around 170. Another scale that you can use is the 0 to 10 scale on the rate of perceived exertion on the Borg scale. I tend to use this scale, the 6 to 20 scale, more than the 0 to 10 because it does correlate to heart rate. It's a good thing to use in the clinic that's easy and doesn't take a lot of time away from other physical therapy activities. All right, so what are the recommendations for aerobic physical activity? The American College of Sports Medicine, the AHA, and the Center for Disease Control recommend that children ages 6 to 17 get 60 minutes of vigorous exercise a day. Adults get 30 minutes of moderate activity 5 days a week, or 20 minutes of vigorous activity 3 days a week. Older adults should get 30 minutes of moderate activity 5 days a week, or 20 minutes of vigorous activity 3 days a week. So the adults and older adults, not a significant change from one to the other. Right, in any exercise program, you're going to have a warm-up, an aerobic exercise period, and a cool-down. So with the warm-up, it needs to be sufficient to increase muscle and core temperature without causing fatigue. You don't want to begin to deplete the energy stores significantly during the warm-up. You do want your heart rate to increase to within 20 beats of your target. The reason you do a warm-up is to increase muscle temperature. This will increase the efficiency of that muscle contraction. You're going to increase the need for oxygen so that your body will begin to extract more from the hemoglobin. It will begin to extract more oxygen from the lungs that will then help circulate it to the body. It also helps to increase venous returns. There's no pooling of blood. Right, the aerobic exercise period. You can have continuous interval circuit or circuit interval training. So continuous is exactly like it sounds. You do an activity staying relatively close to your maximum heart rate for the entire time. You can do this between 20 and 60 minutes. If you're an accomplished athlete, you can go beyond those 60 minutes. Overload is accomplished by increasing the duration of this activity. There's interval training. So this is a period of work followed by a period of relative rest. The rest can be a few seconds to several minutes. The rest can be considered a recovery period where the nutrients are getting back to the body or back to the muscle to be able to be used again. Circuit training is where a series of different exercises are performed one after the other. This can be used to increase both the aerobic and the anaerobic system depending on the circuits that you use. It will be more aerobic when there is fewer rests in between each exercise. And the circuit interval training combines circuit training and interval training, and so you may have a circuit that you work through, but you'll have some areas where you have high intensity followed by rest in between the activities. All right, the cool down period. This helps to prevent pooling blood in the extremities. So if you just stop exercising, the muscle pump does help with venous return, but you have blood flow going out to the extremities. Without that cool down period, the blood continues to flow, and you may get some pooling in the extremities. It prevents fainting by increasing the blood return to your heart and brain. It has been shown to help prevent heart attacks, arrhythmias, and other cardiovascular complications. Right, what physiological changes occur with training? So there's cardiovascular effects that will occur both at rest and during activity. So at rest, you'll have a decreased resting pulse, you'll have more blood volume and more hemoglobin. During activity, you have an increased stroke volume and increased cardiac output, and you will also have a decreased heart rate with the same activity. If you take a highly trained athlete and a non-trained athlete or a non-trained individual, they do the same activity, the trained athlete won't have as much of a heart rate increase that the sedentary individual would have. And then for respiratory, you have an increased lung volume usage and an increased diffusion capacity. So the increased diffusion capacity is increased to that lung volume usage. You have more oxygen being able to transfer in the lungs. All right, so applications of principles of aerobic training in patients with coronary disease. So in inpatient cardiac rehabs, this is typically what happens right after a heart attack, right after heart surgery. You always start at about 1 to 2 METs. You may progress up to 4 METs during that initial stage. But while they're in the acute care stay, you need to monitor them closely. Know that their heart rate, their SpO2, their blood pressure, and their ventilation rate are within the parameters set by the physician. Knowing the MET level of different activities will help you progress that patient. So outpatient cardiac rehab, you start an early exercise program. You also need to take into consideration the METs and increasing it as tolerated. Typical patients in the early cardiac rehab phase will be seen 2 to 3 times a week. You will increase the activity based on their exercise capacity using either the Carvonin scale or a percentage of their heart rate. Duration of exercise usually will start at about 10 to 15 minutes, progressing up to as much as 60 minutes that the patient can tolerate. The type of exercise is usually continuous using large muscle groups and in the aerobic setting. The volume, it will increase as you increase both the frequency, intensity, and time. And the progression is patient dependent. It will depend on their diagnosis and their response to the activity. The deconditioned individual who has a chronic illness, they are more susceptible to deep vein thrombosis, to pneumonia, to tachycardia, and orthostasis. Those who have deconditioning also have a decrease in VO2 max, a decreased blood volume, lower red blood cells, and less plasma. They're at risk for passing out, for syncope, and for orthostasis. They will lose some calcium if they've, especially in their bones, if they've had decreased weight-bearing status. So stimulation of that bone growth is important. Knowing where the patient stands in relationship to how demineralized their bones have been is needed. You need to know that information so that you can progress them appropriately. You can reverse the deconditioning effect. You can increase stroke volume, you can increase cardiac output, and increase their energy stores. So those who are very deconditioned could benefit from aerobic activity, but you will need to monitor the patient closely.